Hi guys, welcome back to Case of Chiro. So in the last episode I spoke about a research study where basically infants and babies who are born with some assistance, they had less range of motion in the neck compared to babies who are born naturally. But in this episode I want to talk about a case study on chiropractic and the breastfeeding baby, a case study that explores cranial dysfunction and the link of it. So it studied a 4-day-old baby boy in practice in Texas in the US. So he presented to a chiropractic clinic for evaluation and possible care due to a latching problem. So he was only able to feed from a bottle, and that bottle had to be in very specific positions. His mum had tried nipple shield. She had also seen a lactation specialist, but then she got discharged with the recommendation to alternate between like bottle feeds or formula milk and alternate between express breast milk as well. So a bit about the boy's history. So at birth he was induced. His mum was strep B positive, and she also had antibiotics, penicillin for it. When he was born, he was posterior. His heart rate would drop during the first stage of 24-hour labor. The second stage of labor was 5.5 hours, and then it ended up with a partial episiotomy. So what did the chiropractor find? So the chiropractor found that his head was tilted and he was rotated and turning to the left. When they checked the leg length of the baby, like leg length, it found that there was like a neck and pelvic involvement as well. The subluxations on motion palpation was at the right C1 and at the back in the T1, T2 and T4. And there was also hypertonicity in some muscles, so extra tightness. So, his mum consented to chiropractic care, containing chiropractic evaluations twice a week, and then spinal and cranial adjustments as necessary. So at the first adjustment, the boy began nursing at the breast straight away, which was really exciting, although it was with a nipple shield, but at least he was able to use a nipple shield. And then the mum had actually said, he had better range of motion in his neck and would turn both directions like much easier. And then by the third adjustment, he was able to nurse using the shield, but he didn't have to be held in certain positions. By week 2, he had full range of motion in his neck, and he was able to feed without having to need that extra bottle to supplement. Week 3, he had complete resolution of all his symptoms, which were less range of motion through his neck, the vertebral subluxations. He had an excessively recessed jaw, inability to open wide, and cranial asymmetry. He also had treatment done by a local pediatric dentist for his lip and tongue ties. But what's something to note is that right C1 subluxation, it was actually there all the way through to the 6th visit. So the researcher did note that the completion of these challenges suggests that there is a possible connection specifically between the upper cervical vertebral subluxation and cranial dysfunction. So in conclusion, the researcher found, further research is required as a case report, carries the normal limitations, plus the limitation that the boy had a lip and tongue tie as well. And if the revision had occurred sooner, we don't know what may have changed, and maybe the boy may not have needed so many adjustments after all to receive the full resolution.